Hi guys, just give me 1 second. Okay, is anyone on? Can anyone hear me? Okay, I am gonna go ahead and take my mask off because I'm in the room by myself and I want to make sure you can hear my voice because it does not project very well. My name's Ashley McFadden. I am clinic manager at the O'Fallon location, and Kinsey and I are really excited to be back today helping with Facebook Live. We haven't done it in a while, but we're both going to join in today. So Kinsey Shouse will be on in a little bit. And so what are we going to talk about? We are going to talk about pre and post ACL reconstruction. So we're going to first dive into a little bit of anatomy on the ACL, exactly what it is. Then I will discuss pre-operative rehab, and we're not going to go into a lot of detail there. The majority of the detail will be spent on the post-op protocol and expectations for PT. So we're going to get started, and I'm going to just give you a little bit of anatomy about the knee. So as we know, the ACL is a very common injury that we see in the outpatient clinic, especially from our athletic population. And we know that there's several ligaments in our knee. So we have the ACL, the PCL, and two lateral medial ligaments. So I'm going to show those to you. So this is our knee. So you're looking at the front view. So we can see the inside of the knee. And there's two ligaments that cross in there. So we have the two ligaments that cross like this. In the front, we have their ACL, and in the back, the PCL. And then we can see we have a ligament on the outside, the lateral ligament, and then we have your MCL, the medial collateral ligament. So just so everyone has a good idea of exactly the role of the ACL, so the ACL is going to prevent that forward movement and that rotation at the tibia on the femur. So it's our main stabilizer at our knee and extremely important. So when you have the ACL injury, main complaint that a patient has coming in, red flag, would be instability, buckling, of course, pain. And we know that ACL injuries are caused through a twisting force majority of the time, a twisting force being applied to the knee while the foot's planted. So we see a lot of soccer players, basketball players, football players, a high level of athletes in the clinic with ACL tears. It can be caused by that planting, or it can also be caused by sudden change in direction, hyperextension, or just landing forcefully on the knee. So again, ACL is that ligament in the front, and there's two different grafts that can be done. So we have a graft, an autograft. So it's coming from the patient itself, or an allograft. It'll come from a donor. And there's three different types that we see in the clinic. So we see either a patellar tendon graft. So coming from the front here, we see the quad tendon or hamstring. So I don't want to go too much into anatomy because we have so much to talk about and why it's important to have that good pre-operative therapy. So prehab is extremely important, and it's shown to improve our post-op outcomes. Not only does it get the athlete back to their sport quicker, but they have less pain initially, they have less stiffness, they have that ideal optimal recovery that we're looking for. So what are our goals initially in therapy when a patient comes in with ACL tear and they're being seen for pre-op? So number one, we want to reduce swelling in the knee. So extremely important that we get the swelling down in order to get their mobility back. And that would be goal number 2. Goal 3 is improve the strength in the muscles surrounding the knee. And then goal 4, as we're getting the movement back in the strength, we want to normalize their walking pattern. So how are we going to do this? So I'm going to teach a few exercises that will focus on range of motion first. So again, the knee has 2 movements that we're going to work on. One will be flexion and one will be extension. So first exercise is going to be for flexion. It's called a heel slide. Patient's going to slide up, hold for a few seconds, and then slide down. If it's easier, you can slide. They most of the time will be doing it without their shoe on, so you won't need this towel. Slide up, hold a few seconds, and down, and just start with about 2 sets of 10 repetitions. Another way they could do that at home, if they're really lacking knee bending, would be to put their foot up on the wall, and then they're going to slide their foot down to work on the bending, and then use the other leg to help straighten it back out. And that would be called a wall slide. And again, as you do it, 2 sets of 10 would be sufficient. So to work on the extension range of motion at the knee, we're going to do a heel prop. So put the towel roll under the heel, and all they're going to do is hang out in that position. So we're letting gravity force the knee down. You should feel a gentle stretch through the back of the leg. So it's important. We want to get the full extension back. We don't want to cause any increased pain with any of the exercises. A little bit of discomfort, but I don't necessarily want that sharp knee pain. So gradually getting the motion back. If you could hold for a minute in this position to start and do 2 to 3 repetitions. 2 more stretches. So one's going to be for the calf. So we're going to use this strap. If you do not have a strap like this at home, CORA Physical Therapy, we have a program called Therapy Essentials. And so if you go on coraphysicaltherapy.com, we do have these straps, and the patients just absolutely love them. So you're going to put the strap around your foot and pull your foot towards you to feel a gentle stretch in the calf. So it's important to keep the calf and the hamstring muscle. So hamstring stretch is going to be straight up. It's important to keep both of those muscles flexible so that you can walk with that normal heel to toe gait pattern. So with both of those stretches, so first for the calf, second one for the hamstring, you're going to hold 30 seconds, about 3 to 5 repetitions. And then lastly, for range of motion, I would recommend getting on a bike. You can start with even 5-10 minutes, work up to 15-20 minutes. The bike is great to keep the repetitive knee flexion to better prepare for surgery. So a few strengthening exercises, and then Kinsey will jump right into post-op rehab. First one is going to be a quad set. So we want to make sure that we're working all of the muscles. So we're going to isolate the quad, the hamstring, and the glute muscles. All the muscles surrounding the knee. So first one's going to be pushing down into the table. So we're going to do an isometric contraction of your quad muscle. The muscle right here. You're going to push down into the table, hold for a few seconds, really flatten your knee. Feel it working the muscle right here, and then relax. So as you push down, hold a few seconds and do about 20 repetitions. When this gets easy, which should be right away, when you learn to use that muscle, again, we're going to progress and do straight leg raises. So it's important while you're doing the leg raise, you're going to tighten the muscle first, lift your leg up, and lower down. Nice and slowly. It's important that while you're doing it, your knee's not lagging. If it is, we don't want to progress to that yet. And the goal would be to start with repetitions, 10 repetitions, 2 to 3 sets, and then as it gets easy, you can progress the repetitions and add weight as well. So we're going to do straight leg raises in all planes. On your side, hip abduction, hip adduction, So I switched legs that I'm working just for the sake of the video so you could see it better. And then prone hip extension. And so we want that to be working the glutes in the back. Of course, you don't want any extra stress to your low back. And again, the repetitions with all of these, 2 to 3 sets of 10. I'm going to go through 2 more things. So standing hip exercises with the exercise band on. Okay, and again, these bands are on our website as well, just to make sure you can get consistent supplies and you feel comfortable with what you're purchasing to prepare at home. Okay, so you're going to go out to the side. You're going to go forward. So we started with abduction, flexion, and then we're going to go into extension. So we're working all those glute muscles, hip muscles to better stabilize at the knee and to prepare for surgery. Lastly, with this band, we'll do a terminal knee extension. So for the quad muscle in the front. So if you have someone to hold it for you, or you can slide it in the door jamb, or stabilize it at a table, or you just need some resistance and you're pushing back against the band. So side view. Extend the knee, hold a couple seconds, relax. And again, our goal will be 20 repetitions to start, and then of course progressing as it gets easier. Lastly, before surgery, if exercises are getting easy, of course, and you can tolerate further strengthening, squats at the wall with the ball would be great. Calf raises, so just standing, raising up onto your toes. These are all great suggestions to better prepare for your ACL reconstruction. Of course, a more isolated, specific program can be provided to you by a physical therapist at CORA Physical Therapy. But this is a general program that allows our population that we see the most, our athletic population, to get back to the sport they love even quicker and recover at that optimal rate. Okay, so I'm going to put my mask back on. I'm going to go in the clinic, and Kinsey is going to begin discussing post-op rehab.
Hello, everyone. I'm Kinsey. So Ashley talked to you about pre-op ACL reconstruction. So I'm going to talk to you about post-op, how that recovery is going to go. She showed you a lot of exercises. A lot of those are going to be incorporated into the post exercise as well. But as you get better, as time goes on, you'll be able to progress those quite a bit. So first off, right at the beginning of ACL surgery, your main ACL recovery goals within the first week or two are to protect the ACL reconstruction. So that's still healing. So you want that to heal as best. You want it to heal well, so you don't want to stress it while it's healing at all. So reduce inflammation and pain. That's another goal, because you're going to have a lot of swelling from the surgery. So kind of getting the pain down, getting the swelling down, because as soon as the swelling goes down and the pain goes down, you're going to be able to do a lot more, and you're going to be able to progress sooner. So you want to really get control of that inflammation, that swelling stage. Restore normal knee range of motion. That's a goal right away, especially the knee extension. I'm sure Ashley mentioned that quite a bit. The straightening of the knee is the most important thing to get back first. We want to get that back within the first 7 to 10 days, because it's harder to get back once. If it goes past 10 days and you're still lacking that straightening, it's harder to get back. The flexion, so the knee bending, can come a little more gradual. So that one kind of comes over the next couple of weeks. So we're not as aggressive with the bending as we are with the extension at first. And then as time goes on, as it heals, another goal is going to be strength training, kind of getting the quad, the hamstring, the glute muscles all equal and not have any imbalances going on. And then obviously for athletes or even adults who have ACL reconstruction, getting back to what you want to do. If that's a sport, if that's your job, if that's recreational activity, just getting back to what you want to do eventually as that heals, so you're not limited after your injury. The first few weeks of recovery, like I had said before, is probably one of the most important parts of it. I know it feels like you're not doing a lot because you're not able to do a lot, but controlling that swelling, controlling that range of motion is going to be the most important, because if you don't have those things, if you have... Hi guys, we got disconnected, but we are back. So I think whenever I dropped, we were talking about kind of the importance of controlling inflammation and swelling and how important that is for recovery long term, because if you're stuck in that inflammation stage and you can't get the swelling down and you can't get the pain down, then you're not going to be able to bend, you're not going to be able to progress with strengthening. So that first week or two of getting the pain and swelling down, even though it doesn't seem like you're doing much, it's going to really be important for your long-term recovery when you get to the more sport-specific strengthening. So like I was saying, I'm not sure if I got cut off before this, but there's a lot of different protocols. Your surgeon is going to have his own specific one. So the one that I go through today, I tried to find one. I kind of took bits and pieces of everyone's that we have and tried to get a general protocol that I'll go through. But again, it's not going to be the exact timeline. Every surgeon is different. It depends on the graft. It depends on if they had to repair other things in your knee. But this is going to be a general one for just your basic, ACL reconstruction. So the first phase, 0 to 2 weeks, is, like I mentioned, controlling the swelling, controlling the pain, getting the knee range of motion down. So getting the extension back is the most important right away, and then slowly restoring that knee bending as well. And so like Ashley was saying, I know she showed you different exercises. The most important exercises the first 2 weeks are going to be, like she was saying, the heel prop. So kind of propping up your heel on a towel and kind of letting it straighten, and then kind of doing some heel slides where you're working on bending. So just a lot of motion. And then she mentioned getting that quadriceps to fire at first is very important, because after surgery you're not going to have any contraction, because they have to kind of go through that muscle to repair it. So it's very weak after surgery. So getting that the contraction back, getting that recruitment back in that muscle is going to be important, because that's going to let you walk without crutches sooner. As soon as you get that quad contraction back, the quicker you are going to be able to walk without a crutch. And then as soon as you're walking without a crutch, you're going to be able to strengthen as you walk as well. So you want to get off those crutches and walking as quick as possible, as long as your doctor clears you to walk without crutches, obviously, because sometimes if they repair other things, you're in a non-weight bearing stage. So this is under the assumption that your doctor has said you can progress off of the crutches. So the 0 to 2 week stage, a lot of motion, a lot of ice, a lot of swelling control, so a lot of massage. A good thing to start right away is getting your patella moving again, so your kneecap. So you can kind of, let me see if I can show you on the thing. So you can kind of take your knee and kind of start just kind of gently moving it, just kind of getting your patella to move again, because that's going to help with, you want your patella moving in that groove correctly, otherwise that's going to lead to other knee pain if it's not moving like it should when you get down to the squatting or the bending or the strengthening phase. And so the next phase is called the intermediate phase, and that's usually about 3 to 5 weeks, 3 to 6 weeks. And that's when at this point, you should have pretty normal range of motion. You should have that quad going a little bit, still very weak, but you should have it going a little bit. You should be able to start bearing weight, so you can kind of start doing more of like the stationary bike, like I know Ashley mentioned for range of motion. You can start with the squats, like start with mini squats and then kind of progressing to deeper squats as tolerated. You can start doing step ups, so getting just a little block or a step at your house and just working on stepping up with that surgically repaired leg, and really focus on contracting that quad as you step up and then stepping down too. And then a lot of glute strengthening at this stage, so still you can't do agility, we can't do plyometrics yet, still just a lot of non-weight bearing, weight bearing strengthening for the glutes. So the leg raises Ashley mentioned are good, bridges. We can kind of start doing a little bit of proprioception at this stage, so a little bit of balance. So I have a foam pad here, so you can kind of start doing some single leg stuff, maybe single leg balance on the floor at first, and then progressing to single leg balance on this foam, which is going to kind of cause your ankle to have to stabilize, and it kind of starts making you focus on stabilizing your knee as well, and it kind of gets the quad going, it gets the glutes going. So kind of working on balance progression, we can start doing that around 3 to 6 weeks. And then kind of the later stage of the reconstruction phase, the protocol is about 6 weeks, 8 weeks, and it kind of goes to about the 12-week mark, give or take a couple of weeks, and that's when we can kind of continue to progress with strengthening, do more single leg stuff, do more squatting stuff. We can get into like the machines, so like leg press machine, hamstring machine. You have a little, it's healing at this point, so you're able to do a little more harder exercises. We can start doing some lunges, side lunges. So you come in here, kind of doing lateral lunges. You can do forward lunges. We can progress with dynamic balance at this point, so balancing on the foam or a Bosu, like the half circle balls, different things to kind of challenge your balance and make you stabilize your knee while you're wanting to kind of shake a little bit, kind of working on that quads more. And then a big thing as we go through the strengthening phase, your PT is gonna have a bunch of different strengthening specific things you can progress to. And the main thing you want to avoid, especially if you have that graft coming from your own body, you're going to have that graft site. So you want to make sure that that's not aggravated at all, because that might cause swelling, it might cause other issues. So you want to be kind of aware if you do have that graft, whether it's patella or hamstring from your body, that you're kind of watching that site too and make sure you're not aggravating that spot. And then usually about 3 to 6 months, we can start doing, not return to sport yet, but doing more sport specific strengthening. So whether it be soccer, basketball, skiing, lacrosse, any sport, we'll kind of start to specify strengthening and movements closer to your sport or closer to the activity you want to get back to, golfing, or even if it's just mall walking, any goal, gardening, anything like that. We can kind of get into more sport specific, activity specific strengthening around 3 months. You can kind of start, most doctors will let you start a return to running program around 3 months. They usually have a pretty set return to run program where it's a little bit of walking, a little bit of jogging, even surface type of stuff. And at this point, you should have normal knee range of motion. You should be getting very close to normal quad strength, hamstring strength, glute strength, so you're able to do a lot more stuff. You can kind of start some agility stuff, like sometimes side to side, not yet, but a little like forward, backward agility, a little bit of jumping, different things like that. And depending on the doctor, usually you can start return to sport about 6 months, 6 to 12 months, anywhere in that range, depending on how the first 6 months of recovery go for you and how the doctor feels, when he feels like it's safe for you to return to sport. So in between that 6 to 12 month range, they're gonna clear you to play sport. So a lot of times the goals before you get to be cleared to play sports is you want your quad, your hamstring, your glute to be up to 90, hopefully 100, but 90 to 100% of full strength of your other leg. And you want it all to be balanced. So you don't want your quad to be 90%, but your hamstring to be 80%, or your glutes to be 60%. So you want all of those 3 big muscle groups to be working together, 90 to 100% of your other leg before you start doing return to sport stuff. Usually we have, people use different testing, but we have different tests. We here use DorsaV. There's a bunch of different apps and tests you can use to kind of monitor how strong your surgically repaired leg is compared to your non-surgically repaired leg. So you want to make sure that is very, very close to equal. You want to have obviously normal knee range of motion. You want to be able to, they'll be able to at this point take you through most of the sport activities in the clinic to make sure you're safe with it, make sure you're doing it right. And then you'll do kind of start with some non-contact drills, usually is how they start, and then you'll move into contact around practice, a little more controlled environment, and then eventually you'll be cleared to return to the sport you're playing. And so the big thing is, that's a long process. I mean, this last stage was 6 to 12 months, so it could be up to a year, but you're doing sport-specific strengthening sooner than that, but it is a very long process to get that to heal and to get back to 100%. One of the most important things we found is that pre-op strengthening and pre-op range of motion is very important. The more motion you have, the less swelling you have, and the more strength you have before surgery, the easier it is to get back to normal range of motion, normal strength after. So it kind of speeds up the process a little bit, and it really helps long-term recovery. Another thing we have, just at the end of the video, I want to say any of the stuff that we use today, so the foam pad or the resistance bands, or we have different ice packs. We have a website on our CORAphysicaltherapy.com that has all of those things on a shop website, and it has, if you're at the clinic and you really like the foam pad they have or the ice pack they have, we have all of that stuff on that website, and a lot of it will be helpful to do so you can do the exercises at home like you do them at the PT clinic, especially when you progress to doing more strengthening. So that's all I have for you. So the main points I think are, in the beginning, making sure your range of motion is good, making sure your swelling is good, and then slowly strengthening as allowed. You don't want to go too fast too soon, but slowly strengthening and getting back that quad back, that glute back, that hamstring back in order to return to sport. So I hope this was helpful, and you can comment under here if you have any questions about anything at all. I know the ACL recovery is there's a lot to it, so we didn't cover everything in the 20 minutes that we had, but if you have any questions about anything, you can comment and we will try to help you out. We will see you next week. Bye.